Ladies and gentlemen, how exciting was that? Really, Arab Health is the place to be. And here at the M42 main stage, well, I did say we have an illustrious list of speakers and special guests, as we've just seen there. Now, to do a deep dive into healthcare visionaries, providing world-class care beyond borders, I am so pleased to announce the next list of speakers who'll be joining me on stage. Can we please invite Dr. Mumtaz Khan, Chief of Staff, Cleveland Clinic, Abu Dhabi. Please give him a big round of applause. Dr. Khalil Afsh, who's the Medical Director at HealthPoint. Please give him a big round of applause. And Dr. Sumaya Zahir, who is the Medical Director at Danat El Emirat, the Hospital for Women and Children. Thank you so much. And I shall take my moderator chair here on the right. Now, M42, in my head, we're talking about the nexus between healthcare, sustainability, and technology. When I come up with those buzzwords, what buzzwords come to your mind?
So for us, the best buzzwords are all about patient care and quality and access and data and development in health practices.
Fantastic. So that's Dr. Mumtaz Khan representing Cleveland Clinic Abu Dhabi. You really went for the big words there. And moving on to Dr. Khalil Afsh, Medical Director at HealthPoint, what are some of the buzzwords that come to your mind when we talk about health and technology intersection?
Healthcare technology, sooner or later, tomorrow, is going to impact every single one of us on a daily basis. That's what I'm thinking right now.
So it's that application to everybody across the world. Now, Dr. Sumaya Zahir, how about yourself?
So for me, I would say if we're talking about digital technology and how it impacts patients, we mustn't forget the ultimate goal, it has to be people-centered and easily accessible. Without it being easily accessible, it means nothing, no matter how fantastic the technology is.
So there I'm hearing easy accessibility, healthcare that's available to everybody, and a real kind of data focus. Now, coming back to yourself, Dr. Mumtaz Khan, when it comes to Cleveland Clinic Abu Dhabi and pioneering complex healthcare for the UAE and beyond, can you please break that down for people who might not be familiar with what Cleveland Clinic offers?
So, we are part of the Cleveland Clinic Health System. And we are fortunate and blessed to have had the support of the UAE and partnership with M42. When we talk about Cleveland Clinic, we are destined to provide quality and world-class healthcare to the people of UAE.
Please just put your mic all the way up.
Sure.
That's it.
And the most important thing is that this would help reduce the burden of patients from the United Arab Emirates to travel abroad for care that was not available within the UAE. And it is evident that we are focusing on complex care. So when we talk about complex care, we are the only solid organ transplant center in the region. We've done over 500 transplants in the last 6 years, and we continue to build on our solid organ transplant program. We have been awarded the Center of Excellence for Stroke and for Critical Care, which we also excel in. We have a 78-bed ICU in our hospital, and that continues to grow and is extremely important. We have also been the Center of Excellence for Heart and Vascular Diseases and thoracic diseases. Then we recently opened our multi-specialty cancer center, the Fatma bint Mubarak Cancer Center, and we provide all cancer care in essentially all solid and hematological malignancies.
So that sounds suitably comprehensive. Many different areas
Absolutely.
of complex care being catered for
Sure.
for the first time as well. I'm going to bring in Dr. Afshan right now. So representing HealthPoint here, the medical director, when we talk about that intersectionality of health and technology, you mentioned earlier about providing healthcare for a larger pool of people, ideally everybody across the world, making it more accessible. Technology, and what are you currently doing to advance healthcare at HealthPoint?
Basically, we are really at HealthPoint trying to get cutting-edge technology into our system. HealthPoint originally came up to be a surgical hospital. We still are. So basically, in every surgical specialty we have, we try as much as possible to bring cutting-edge technology. For instance, orthopedics, we do really complex scoliosis surgeries. We do robotic-assisted joint replacements and the likes. In addition, in other places, we're doing quite a good thing. But let me just divert one thing about it and just talk a little bit about why technology is very important. People don't know, if we look at this aspect, we are right now in an evolution. There is a revolution in the world. We are getting data on a daily basis from everywhere. So we really have to implement technology in order for us to build on it and take care of it. When it comes to patient care, when we apply new technologies, we're looking at few things. We want to decrease their recovery time, we want to give them less pain, and we want to get them out to work earlier, right? And that's exactly why we need technology, and that's why what we're doing at HealthPoint right now.
I think that's really intriguing, and as you say, it's this idea of a revolution that is unfolding, and data really is at the center of that. That's your emphasis there.
Absolutely. Unless you are at the center of the revolution, patients are life witnesses to everything that happens to them. Patients understand. And now patients, actually the interactions between patients and device and apps and healthcare apps and the forth, they know what's going on, and they really expect from you the best. So unless you give them the best, you'll be second tier. You'll not be the first tier. And at HealthPoint and M42, we really want to be the first tier at all times.
I think those are really admirable ambitions, and they certainly are a very good mission to be aiming towards. Dr. Samaya, if we may build on Dr. Afsh's points there, he was talking about this idea of ensuring that the revolution in data is really impacting all patients. But of course, the helicopter view is that 53% of the global population has no access to primary health care. So how are we leveraging tech to really support patients across the world?
Great question, Amandeep. And I think we're here as healthcare visionaries, right? So I think our role is more than just local. It's about a global perspective. And when we're talking about primary healthcare, so what do we mean by primary healthcare? Primary healthcare is the basic package of healthcare services that are needed to prevent illness, promote health, manage disease, and that will encompass about 8% of a person's health requirements over their life. But yet, it's still afforded to so few globally. So what do we need to do about that? And I would like to propose investments in technology that will actually harness and improve patient care. And there's 5 main areas. Now, working obviously as a medical director for a women and children's hospital, I'm going to be biased because I'm a woman, but also I'm a massive, passionate advocate of global women's health. And that really is because for me, it is so central, the women's health in the family. Women and children are disproportionately members of society that are impacted by their ability to access care. And so it is on us as healthcare visionaries and healthcare providers to improve that access. So my 5 areas that I would like everybody to leave and think about and how we can improve and innovate on. Firstly, connected diagnostics. Now, there's not a single health professional that works in a hospital without talking about electronic medical records. So we need electronic medical records that, firstly, easily accessible for the healthcare provider. They can be updated easily. We need them to be accessed by other healthcare providers that work in other healthcare facilities. And we need them to communicate to mobile health apps. We need them to communicate to handheld diagnostics. All of this communication in a broader kind of healthcare ecosystem so that you've got coordinated patient care with the patient at the center and information giving that is free, really going between different healthcare facilities. Secondly, I'd like to talk about telemedicine. Now, obviously, that's probably an area that we all know a little bit more about with the COVID-19 pandemic. So telemedicine there's been a huge amount of investment in telemedicine, and this has allowed healthcare providers to be able to access patients remotely. And very important for those that live in very remote areas, very important for those who have limited mobility, to allow the healthcare providers to be able to access patients and provide that continuity of care. So it shouldn't necessitate pandemics for innovation to happen, but absolutely that was a time for everybody that worked in the healthcare system to realize how quickly innovations can happen. And there wasn't a hospital worldwide that didn't suddenly rapidly invest in its telemedicine platforms or virtual or video conferencing to allow that continuity of care to happen. And thirdly, I'd like to talk about also disease prevention or health screening. There has to be ways of allowing or innovating for better health screening so we can catch diseases much earlier, we can allow for much more timely intervention. And there are lots and lots of examples of innovation. So one that I would like to mention, which is a very simple one, we know that chronic respiratory diseases at least 10% cause 10% of deaths in India, for example. And a very simple AlveoFit, which is a point-of-care handheld testing device that allows screening for your lung function, will allow accurate, immediate diagnosis by a healthcare physician. So I'm an obstetrician and gynecologist, but here I'm talking about a completely different area, and I think that's what's important. When you're a healthcare visionary, you have to cross over different boundaries, but it allows immediate diagnosis and allows the clinician to kind of refer on. So if you're in a primary healthcare setting, to then identify which patients need to be transferred to secondary care or tertiary care.
Dr. Samaid, if you could just hold up your
Sure.
mic. I'm going to get you to
Sorry.
just name the last two because I want to bring in the gentleman as well. So you've already mentioned diagnostics being improved. You talked about telemedicine and also disease prevention, but there's two more.
So yeah, disease prevention and health screening, and then I would like to say, so health education, hugely important. We need to empower patients to understand better their own health and to therefore know how to manage their own health. So there's lots of things in podcasts, online courses.
And the last one?
And the last one is obviously patient compliance. We need patients to, there's huge amounts of information now about diseases. How do we ensure that they continue to engage with the healthcare provision?
Fantastic. That was really insightful there, Dr. Samaya Zahir. You really set the scene there in terms of many different threads that we can pull on. But I want to ensure that I bring in Dr. Mumtaz Khan. Is there anything in regards to what Dr. Samaya Zahir has outlined there that you want to build on?
Sure. So I think when you're talking about the medical record system, it absolutely, I mean, providing an electronic health system which can be available to the
Please
region,
bring the mic all the
and
way up.
essentially, the data can be available for the healthcare providers, but at the same time, the security of the health system is extremely important. We want to maintain that the privacy of the patients is maintained, and the electronic health system that we are utilizing is kept secure, and I think that's where most of the advancements are doing, and that's where all our data sets come in. And it's not just that; it's a matter of improving access through our data sets that we are providing. So I agree with all the points that we are doing. Even at the Cleveland Clinic system, we are investing in areas where we can provide personalized and precision medicine for personalized care, and I think that's where medicine and healthcare is moving towards that. It's moving away from hospitals. We want to make sure that the journey of a patient is kept as comfortable for them and as complete and comprehensive as possible. So things like, wearables and using AI enhanced tools just to make sure that people are able to get access to our care in a timely fashion, and which is convenient and efficient for them. And that's where all the focus needs to be now.
Absolutely,
Yeah.
and I thought it was really poignant that you mentioned there, Dr. Mumtaz Khan, about the mitigating the risks of privacy and data protection. I'm just going to bring in Dr. Khalil Afsh before I open it up to the audience, so please do have your thinking hats on. But before I bring them in, are there other risks that we should be concerned about when it comes to the intersection between technology and health?
One of the most important thing is actually data protection, as Dr. Mumtaz said. Now we're looking at new technology. It's called blockchain,
Yes.
technology that actually can protect patient data. The other important thing that I'd like to interject on a little bit is when looking at how the world is changing as being part of a visionary physician, I have to look at the data and see where we're going. I just mentioned at the beginning that there's an explosion of data. Every second, there's a huge amount of data being brought in, believe it or not, by digitizing patients. Now patients are being digitized. So they are faced all the time with apps, healthcare apps, wearable technology, the purpose of which is to get all this data, analyze it, and depending on which data you're looking at, it either can get digested and something can come out of it, or actually sits there. Do you know that by the year of 2020, there's around 1,400 human device interaction per person per day? And that is supposed to go up in the next coming year or so to be around 5,000 per day. And believe it or not, most of that is what? Health related. So we have 5,000 interactions with every patient with their device. Most of this data is health related. And interestingly enough, actually, I didn't know this before, but most of the data volume in the world is healthcare related. So it's even more than media, movies, finance, manufacturing. So that data is there somewhere. So you're talking about the risk. I worry about such data. And nowadays, we have to look at the data that, because let me be very honest with you. When I am having a wearable device such as my watch or my iPhone, that data is coming to me and it's personalized. So it's basically now being called data like a genome, data So it is private. So in order for me to keep it private, we have to really work and lobby for any system that's trying to get this data and see what we're going to do with it, similar to our EMR records. We really have to protect such data because that data is extremely valuable. And the amount of information we get from this data can change the face of the earth in terms of healthcare. Imagine if you know right now how many people sleep less than 4 hours in the world, right? Imagine if you have this data, what can you do with it? So this is probably to answer your question, is that data of patients in all the aspects, whether it's in the hospital or on your phone, should be adequately protected.
I think that's a really thought-provoking point for us to definitely give some more thought to. As you say, that collection of the data, but also the protection of the data is absolutely vital. I did say I'd open it up to the audience. Please don't be shy. Do you have any questions? Oh, brilliant. We've got a very enthusiastic 2 questions at the front. May we get some mics to our audience, please, so that we can interact and ensure that they are being dynamic as well. So Ben, I think can we get a mic to the audience member? And if you could pass it on to each other. Please introduce yourself and who your question is for.
Absolutely. My name is Alexandra. I'm the CEO and co-founder of MindEasy, a mental health company that offers services in different Arabic dialects. I grew up in the Middle East and studied in North America, and one of the major discrepancies that I see is the stigma that's associated in mental health, specifically in the region. So I wanted to see how your facilities, your clinics, and your hospitals tackle the stigma, and if you see growing concerns toward mental health.
Fantastic. We've only got a few minutes, so just a very top-level answer, if that's okay. Great answer. So maybe Dr. Samaya Zahir, if you'd like to begin.
My top-level answer is, please join us tomorrow, where we're going to be having a whole session dedicated to mental health and maternal mental health, because that's how important it is. And I think the stigma is tackled by us talking about it openly and having the confidence and knowledge to do so.
I really appreciate your plug. I'll be doing that session with Dr. Samaya Zahar. Please do join us for that. And please do.
I'm very happy you asked this question. Do you know that in 2030, the burden of disease in the world is not going to be anymore what we know right now. It's going to be mental health. The stigma is there everywhere. You know, I was in the US and now I'm here. So stigma is present. But I can tell you one thing. Again, advance of technology, advance of the interaction of patients with digital devices on a daily basis is really helping a lot. Okay?
Fantastic. I'm going to have to move on because only a top-level answer, please. Dr. Khan.
So I can just plug in that it's not just mental health of the patients, it's also mental health of the caregivers. And so, you know, we talk about burnout and we talk about, you know, overworking and no work-life balance. All of those things are important. So, you know, this is an extremely important aspect which we are constantly focusing on. Yeah.
You know what, that's a really insightful point to end on. We're talking about a work-life balance. We're going to have the balance of one quick question and then a 10-second answer, and then we are going to conclude. So quick question, please.
My name is Yasser Abu Samid. I'm a clinician pulmonologist. The question for anyone really. going back as an intern at the Cleveland Clinic, I was taught that the best practices are drawn from high-level evidence and research, like RCTs, etc. Do you see any challenges between the fast development of platforms and software in important things like, diagnostic accuracy, data privacy, and cost effectiveness when it comes to having that type of research and evidence and implementing these platforms and programs?
Perfect. That's a big question. So maybe a small answer, just as a taster. Who would like to take that? Okay, so Dr. Ash, would you like to take that?
I mean, nowadays, a lot of things are happening. And as you
Please
know,
bring
the
your mic all the
CDSS,
way up because it's very loud. So
the CDSS model is something that we're looking for. And as you know, it's been implemented, basically, the clinical decision system support. And it's actually being implemented in every EMR right now in the West. And it's approaching currently here to help patients with evidence-based, fast clinical decision making.
Fantastic. You know what? We've got more questions, I know, but our panelists are really approachable. I've already spoken to them off stage. Catch them for a coffee as they'll be wandering around. We've got a full day's worth of programming. We're going to go straight into our next panel discussion in the next few minutes. But please allow me to say thank you to Dr. Samaya Zahar, the medical director of Danat, and Dr. Khalil Afsh, who's the medical director of HealthPoint, and Dr. Mumtaz Khan, who's the chief of staff at Cleveland Clinic, Abu Dhabi. Please give them all a big round of applause. Thank you. And while we have the official photographer handy, we'll just take a quick photograph of everybody. We can stay seated because I actually quite like seated photographs.